What you can't see can harm you. That's why today we're revealing shocking germ traps. So let's talk about scrapes, cuts, strawberries, aka road rash in some cases. So who's ever had that boo-boo and blown on it after you fall and cut yourself and go?
Well, and every mommy, I think, has had to do this, you know.
But,
I mean, how do you say no when the kid says blow on?
Blowing on a boo-boo is a no-no. Because think about it, you're blowing all that bacteria from your mouth into an open wound. And that's not what you want. So let's bust some first aid myths. What every wound needs is wound irrigation. So saline water or even tap water, you need to clean that wound out. So we have a couple different types of wounds here. And obviously the wound type does determine what you're ultimately going to need done.
Is this all the same person?
It could be. It could be. Oftentimes what happens is people will injure themselves. And a good example would be, let's say you fall and scrape your knee. And it hurts. That's why we blow on it. But the last thing you want to do is ignore it because it hurts. You have to wash it out. So high pressure irrigation. Now, studies have shown that just high pressure tap water works just as well. There's commercial saline products that, you know, if this were a wound, you can see that gets pretty good high pressure. You got to get in there, get all the dirt and grime out, no matter what the wound type. And a good example here is, this is road rash. There's a lot of gravel in there. If you don't get that gravel out, it will become a nidus for infection, and it will not heal. So you've got to get high pressure irrigation, which will get all these, and this is a prop, so I'm not going to spray water on it, but all that high pressure irrigation will get all those little small pebbles. Well, what can you do with some of those bigger pebbles? Go ahead and take an alcohol swab, not on the wound, because that will actually kill good skin cells, but clean off the tweezers, and if you need to, you actually can get in here, go ahead and pull out any remaining pebbles. Make sure you get these out because the wound will not heal as long as these are in there. And the last thing you want is a wound to close up over a pebble. And this is an example right here of one where it's a little bit caught. If you are in a situation where you cannot get these pebbles out on your own, when do you go to the doctor? Well, there's a couple different reasons. Number one, if you have a gaping wound that will not come together, if the skin edges will not come together, like in this, you know, that's right over a joint, which on the hand, a big deep cut over a joint is worrisome because did it get into the joint? You're going to want a doctor evaluate that, and this could use a stitch or two to bring those skin edges together. Puncture wounds are difficult because this is a puncture wound on the bottom of the foot. If you're a diabetic or at risk for severe infections, you should have this looked at most likely, or at least have your doctor keep an eye on it. But the same idea, you want to clean this out as best as possible. If you don't have your tetanus updated, make sure you get your tetanus updated. Road rash is a different story. I fell off my mountain bike, as you all know, about 4 weeks ago, and all over my body. It's healing now. But I remember I had, in wounds on my knee, on my hip, I had gravel in there, and it hurt. And you have to sort of grin and bear it to get that gravel out. If it hurts so badly that you can't do it, what we'll do in the ER, we'll actually give you IV narcotics sometimes to blunt the pain response so we can really clean it out well. Otherwise, it's never going to heal.
Right.
So avoid hydrogen peroxide. That only kills good skin cells and those wound healing cells. Avoid blowing on the boob. High pressure irrigation. Clean out the wound. Then you can apply some antibiotic ointment and go ahead and cover it up to protect it. The other myth, Dr. Worden, you probably hear this all the time. People think that a wound needs to breathe. The truth is, a lot of times wounds, particularly certain areas of the body, by covering them up with a sterile dressing, it may heal quicker.
I mean, studies have shown that healing takes place quicker in a moist environment. So that's why we like to put a little Neosporin and to keep it covered.
Last but not least, after the wound occurs, if you see spreading redness away from the wound, if it becomes more warm to the touch, if you start to notice pus coming out of it, if you start to have fevers, those are all signs of a skin infection that will likely need antibiotics. Get it checked out.